Alright, today I'm going to do an ABG, and so the first thing I need to do before I go into the patient's room, I always need to check the charts, so I'm going to always check the charts just to make sure, see if they're on any medication that could cause them to bleed longer, if I need to hold the site a little longer after I draw the blood. So once I am ready, I always knock on the patient's door, and I'm going to introduce myself. Hi, my name is Amy. I'm a respiratory care student with the respiratory care department. And so before I go and draw the blood from the patient, I always need to check to make sure they are the correct patient. Check their ID band for their name and date of birth. So once that is all done, I need to explain to the patient what I will be doing. Alright, so today I'm going to draw an ABG. That's just to see how much oxygen is in your blood, to make sure you're getting enough oxygen and to make sure that is not causing any of your problems today, okay? So what I'm going to do, I'm going to draw it from your radial artery, and I'm going to check it from there, and it's just going to be a little more painful than your normal blood draw. So when I do this, I need you to be very still. I don't need you to move, because if you move, I can puncture something else, and I don't want to do that because that can harm you and it can also harm me. So when I go to do the patient, I always need to wash my hands again, make sure before I touch them. And then I need to apply the appropriate PPE. And sometimes if I feel like they're kind of shaky or something, and I feel better if I wore a mask just in case if something happened, then I can wear that. So I'm always going to wear gloves when I do a blood draw, because you don't know exactly if they may have something that you don't want to get on your skin. So what I'm going to do first is make sure there's something underneath the patient's arm. So it needs to be kind of extended out like this. Have like a towel or something, paper towel roll, something underneath. Just that way it'll make it a little easier for me to get the blood draw. So what I'm going to do first is do the modified Allen's test. I need to check to make sure they have a good flow. So what I'm going to do is occlude the radial artery and the ulnar artery. So when I hold those down and occlude those flows, I need to have the patient do a fist 3 times. And on the 3rd time, I would release the ulnar artery, and then I would see what their skin would look like. So I need to make sure their skin flushes back into 3 to 5 seconds. So once their skin comes back, I always want to do the non-dominant arm. If that does not work, if their flow doesn't seem okay, I can check the dominant arm and see if their flow, and do the same thing with the modified Allen's test. So when I'm ready, I at least need to make sure I take my alcohol prep wipe, and I need to wipe it around where I'm going to puncture the site in a circular motion, because I don't want anything to get in the, especially where we're drawing the artery. From the artery, I always need to make sure that is good. So I need to always make sure I have my gauze with me, my stopper for the needle, that way I don't puncture patient or myself, and I also need the stopper. So when I'm ready, I'm always going to palpate radial artery to make sure I can find it again. And once I'm ready, then I will get my needle ready. And I always need to make sure I have my bevel up. Once I have my bevel up, that is the way I need to go in, because I don't want to puncture something else and hurt anything else inside. So I need to make sure I have it at a 45-degree angle, like you're holding a pencil. So I'm always going to go ahead again. I'm going to palpate the radial artery. And when I'm ready, I can remove my finger like that. And then I should start to see blood flow into the tubing that it is set at. I don't want to move like the needle around, and when I'm ready, I need to put gauze there. And then when I'm done, I would stick this into here, I'd push it into there, and it curls the needle, and then I would dispose of the needle into a sharps container. So when I am done, I need to hold this for at least 5 minutes. If this does not, if they're on an anticoagulant or anything that could cause like a blood thinners, any kind of blood thinners, I need to make sure I need to hold more than 10 minutes, because I don't want them to bleed out while I am doing everything. So I need to place the Band-Aid on, and I need to let the patient know that they need to leave this on for at least 4 hours, just so that way we don't have any bleeding, anything like that. So when I am done, I always need to place this stopper on. I need to make sure there's no clots in the needle. And so I'd place this stopper on and I'd place it into my biohazard bag. And then when I am ready, I need to write down on my label, I need to get to the patient's name, the temperature, room number, date, the test that I did, and then the time that I did the test, and if they're on oxygen or on room air, so I need to write down the FiO2. So like if they're just on room air, I need to put the FiO2 is at 21%. So if I can't get back to the lab in a manner time that I need to get the blood sample there to where it's not gonna clot, I need to put it on ice. And then once I am all done, I always need to make sure everything is cleared out. I need to make sure everything's disposed of, make sure the patient, assess the patient again, check them vital signs, make sure they're okay. And then I would remove my PPE and dispose in the proper wastebasket, wash my hands, and then I would chart everything on their chart just so that way the other nurses and ARTs know that I got the blood draw done. And then I'd go to the lab.